Dr. Hannah Wardill. I'm a biomedical researcher from the University of Adelaide and also South Australia's flagship medical research institute, SAHMRI. Here I lead the Supportive Oncology research group, which is all about improving the health and well-being of people affected by cancer. Yeah, I think I had a relatively linear career trajectory. I did an undergrad in health sciences. I knew that I really liked the health and medical field, but I wasn't entirely sure where in that field I wanted to land. So I did my undergrad in health sciences. I did a third-year research project in the area of supportive cancer care, and I really enjoyed this field. I enjoyed the curiosity that came with research, and so I decided to do my honours project in that same topic. And then carried on to complete a PhD in 2016, which was really around understanding the interaction between the bacteria that live in our gut and our immune system, and how these interactions are changed by common cancer therapies like chemotherapy. My research program is fairly broad. I now lead a team of about 10 people, and there are a number of different projects that we have within our group. However, they really are all unified by this common goal of improving the health and the well-being of people affected by cancer. But importantly, they really do span right from very preclinical discovery-based research. For example, one of my students is modelling the blood-brain barrier in the lab at the moment using human stem cells, and we're using this model to try and understand how chemotherapeutic drugs are able to hijack the special lining of the brain to cause neurotoxicity in children with cancer. At the other end of the spectrum, we have projects that are in clinical trials. So for example, we're conducting 2 clinical trials at the moment in people with cancer. One is looking at the effectiveness of medicinal cannabis to help control or alleviate the symptoms and side effects of chemotherapy. And we're also doing another trial in people with blood cancer, looking at how we can better support the gut microbiome in these people by giving them fecal transplantations. So we have a number of projects that are happening. They very much span right from bench to bedside, but they are very much united by this idea of addressing the negative side effects of chemotherapy and other cancer medications. Supportive cancer care is a bit of a niche field. It's certainly an area that I think is growing, and this is growing because we now are starting to see a huge number of people living beyond a cancer diagnosis. So in Australia at the moment, there are estimated to be about 2 million people living either with or beyond a cancer diagnosis. And these people are living decades with this condition. And so we're starting to recognise that these people are not necessarily living well after their cancer diagnosis and after their cancer treatment. And so the area of supportive cancer care is really starting to grow. But it still is a bit of a victim to low visibility and poor priority. I think people consistently think that the side effects of cancer therapy are something that you just need to put up with, something that you need to endure in terms or in your quest for a cure. And so I quite like the idea of challenging that assumption and saying that actually no, we need to prioritise people's quality of life throughout their cancer treatment. We need to understand these side effects, and we need to find ways to prevent or better manage them. So I think this idea of sort of challenging these historical perspectives around the side effects of cancer therapy is really what helps me stay motivated and passionate about this particular area. I also really like the fact that it is extremely patient-centric. It still has strong opportunities for scientific innovation and creativity, but ultimately we are addressing unmet needs of people affected by cancer. And so there's a strong degree of interaction with people with lived experiences. So I'm consistently talking to people, understanding what their areas of or their challenges are, either during the absolute pits of their cancer treatment or in their life after cancer, and I'm using that information to inform how my research is designed and implemented, because we need to really address the problems that are being told to us by the end users, by people affected by cancer. At the moment, I am in the absolute thick of renovating a house. So that is taking up a lot of my time at the moment, but I absolutely love it. I love getting my hands dirty on the weekend, learning about concrete, understanding elements of the construction. I think for me it's an opportunity to, again, exert my creative side, I suppose. I think people think scientists are typically not particularly creative, but I think I like to challenge that. I consider myself fairly creative, and renovating this house at the moment has given me a nice opportunity to show that creative flair and have some fun doing it. But it's certainly been an interesting grind. It's been a challenging couple of months. But beyond the house renovations, I really enjoy gardening. I enjoy getting out in nature, hiking, traveling. Another big benefit of science is that it is a universal language. Science happens everywhere, and so I've been lucky enough to travel the world as a result of my research, and that has been an incredible benefit both professionally and personally.